Abdominal aorta is key to understand the blood supply of the abdomen. I mean, if you want to understand the blood supply of the abdomen, then this is a necessary requirement for you. What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Ken. But if this is the first time you've seen this channel, don't forget to subscribe. Today we're going to talk about the abdominal aorta, and the abdominal aorta simply means the aorta of the abdomen, period. So shall we call our session off? No, not at all. This is just a tip of an iceberg. And let me take you back to the heart. We said we have one of the biggest artery in the body, which is arising from the left ventricle. It is called the aorta. And the way the aorta means arising, because it's arising from the heart. And this aorta is going to, the very first part of this aorta is called the ascending aorta, because it gives this impression of ascending, because they're rising, ascending, okay? This ascending aorta is going to curve at the sternal angle of Louis to form the aortic arch, or the arch of aorta, and this arch of aorta is going to descend in the thorax to form the thoracic aorta, which is also called the descending aorta. And this descending aorta is going to punch the diaphragm here at the level of T12 through the aortic hiatus to form the abdominal aorta. This is to say the abdominal aorta is a continuation of the thoracic aorta once it punches the diaphragm at the level of T12 through the aortic hiatus. Now it is anterior, it is passing anterior to this median arcuate ligament here, and then it is they are related to the lumbar vertebra in a way that the abdominal aorta, it is on anterior surface on the lumbar vertebra, but a little bit to the left side. Look, it's a little bit to the left side here. Okay, now why to the left side? You can see like the aortic arch is happening, like the curving is happening toward the left side, and so this is why we have it is a little bit on the left side of the lumbar vertebra. Now, what's the relationship between the inferior vena cava and abdominal aorta? The inferior vena cava is on the right side of abdominal aorta. Remember, we've said that abdominal aorta is a little bit twisted to the left side, and so the right side is occupied by the inferior vena cava. And this reminds me of famous TV show Titanic, where you have Jake and Rose, and Jake is on the right side of Rose, and Jake here representing the inferior vena cava, and Rose representing the abdominal aorta. And this is a very, very beautiful relationship that you can always use to remember this relationship between the inferior vena cava and abdominal aorta. Jokes aside, let's talk about the branches of abdominal aorta. Now, the abdominal aorta has got a lot of branches, and for convenience, these branches are divided into three groups. The very first group is a group of unpaired branches, and they are coming either anteriorly or posteriorly. And then we have paired branches, which are found on either side of the abdominal aorta. And last, we have terminal branches. The terminal branches, they are also paired, and they could be included in the paired branches of abdominal aorta, but they are left aside just for convenience that you know we have terminal branches. We're going to discuss each one, starting from unpaired branches. The abdominal aorta has got four unpaired branches, and these three are found from coming from the anterior surface of the abdominal aorta, and then one branch is coming from the posterior surface of the abdominal aorta. So the branches are, number one, the celiac trunk. Remember, it's a trunk, one of the biggest of branches of the abdominal aorta. And then we have the superior mesenteric artery. The superior mesenteric artery is also coming from the abdominal aorta. And then we have the inferior mesenteric artery. And lastly, we have the median sacral artery. The median sacral artery is like a remnant of the caudal aorta. The median sacral artery is also called the middle sacral artery. It's a remnant of the caudal aorta. Now, these three unpaired branches of the abdominal aorta, they are supplying the structures of the digestive system. Okay, they are supplying the structures of the digestive. They are very, very important. And if you divide your digestive system, the gastrointestinal tract, into three parts, we have the foregut, and the foregut is coming all the way from the distal part of the esophagus to this second part of the duodenum, is called the foregut. And then from the foregut, from the the second part of the duodenum all the way to the first 2/3 of the transverse colon is forming the midgut, and lastly from the distal third of the transverse colon all the way to the rectum, this is forming the hindgut. Don't worry about this. We're going to discuss them in details. Now, the foregut is receiving blood supply from the celiac trunk. The celiac trunk is designated to supply the foregut, the structures of the foregut, including liver and some liver, spleen, stomach, and the structures above, in this foregut. And then the midgut is receiving the blood from the superior mesenteric artery. The superior mesenteric artery is the primary artery which is supplying the structures of the midgut. And last we have the distal third, the hindgut is receiving blood from the inferior mesenteric artery, and the inferior mesenteric artery is the artery which is designated to supply the structures of the hindgut. And this is very, very important. We're going to discuss them as well when we are doing the anatomy of the abdominal viscera, like the viscera within the abdomen. Okay, and then let's go to the paired branches. We have 5 sets of, not 5 arteries, we have 5 sets of paired branches from abdominal aorta, and these 5 sets, they are going to give 8 arteries on either side. Okay, what do I mean here? Like the very first set of abdominal aorta is this inferior phrenic artery, and the inferior phrenic artery is going to supply the diaphragm, right? Inferior phrenic for diaphragm, but it also gives some branches that are going to supply the esophagus here, the inferior phrenic artery. And next we have the middle adrenal arteries. The middle adrenal arteries are also called the middle suprarenal arteries, because the adrenal gland is also called the suprarenal glands. Why? Because it's on the top surface of the renal, of the kidney, and this is why it's called the suprarenal gland. Now, so we have the middle suprarenal artery, which is coming directly from the abdominal aorta, and then we have the renal arteries, which are going to supply the kidneys. It's going to supply the kidneys. Now, why? Someone is asking himself, why middle suprarenal? Why not superior or inferior? Listen, this is the suprarenal gland. The suprarenal gland is receiving blood from 3 arteries: superior suprarenal arteries, or the superior adrenal artery, the middle adrenal artery, and the inferior adrenal artery. Now, the superior suprarenal arteries are coming from the inferior phrenic artery. So this is inferior phrenic artery. You see, it gives branches that go to supply the superior part of this adrenal gland. So the superior suprarenal are coming from the inferior phrenic arteries. And then the inferior suprarenal arteries, they are coming from the renal artery. They are branching from the renal artery. And so only the middle suprarenal arteries, or the middle adrenal arteries, that are coming from the abdominal aorta. The rest are coming from the branches of abdominal aorta. And next we have next set, we're going to see the gonadal arteries. And what are the gonads? Gonads are testes in men and ovaries in women. So these arteries, the gonadal arteries, they are testicular arteries in men, and they are ovarian arteries in women. This is to say, the testicular artery is taking origin from the abdominal aorta. Testicular artery is coming from abdominal aorta, same as the ovarian arteries, they are coming from abdominal aorta. And this is because embryologically, the testes and ovaries, they are developmentally starting from the abdomen, and then they are later descending, especially testes are descending back to the pelvis. And this is why their blood supply is derived from abdominal aorta and not the blood supply from the pelvis. This is very, very important to note. And next we have the lumbar arteries. Now you see we have the first set 1, 2, 3, 4 on either side, and then 5 set, the 50th set. But the 50th set is called the lumbar arteries. We have 4 lumbar arteries, and this is why I'm saying, like, we have 5 set but a total of 8 arteries, because these 4 plus 4 lumbar arteries making a total of 8. Now these are the lumbar arteries that they are coming from the posterior lateral surface of the abdominal aorta, and they are going to supply the wall of the abdominal wall. Okay, are you ready now to discuss about the terminal branches of abdominal aorta? So we have one pair of 2 terminal branches. We have 2 terminal branches of the abdominal aorta, and the very first one, they are all called the common iliac arteries. So we have the left common iliac artery and the right common iliac artery. These are the branches of abdominal aorta. Putting all together, we have unpaired branches, 4 unpaired branches. We have seen 5 sets of paired branches, which means we have 8 paired branches on either side. 8 on the right and 8 on the left. And lastly, we have 2 terminal branches, which are the common iliac artery on the right and on the left, which could also be included in paired branches because they are also paired. Okay, but they are put aside just for convenience, for you to understand. Now we have a lot of events that occur in a different vertebral levels. A lot of events of the abdominal aorta. For example, we have said the abdominal aorta enters the abdomen at the level of T12, and so the T12 marks the the proximal beginning, the proximal end of the abdominal aorta, and then at the level of L1, at the approximate level of L1, we have emerging of the celiac trunk. The celiac trunk is emerging from the abdominal aorta at the approximate level, at the upper border of L1. And some literature suggests that it's between T12 and L1. And then on the same L1, we also have the emerging of the inferior and superior mesenteric artery. But the superior mesenteric artery is emerging approximately 1 centimeter below the origin of the celiac trunk. The celiac trunk is on the upper border of the L1, and then the superior mesenteric is on the lower border of L1, which is 1 centimeter below the origin of the celiac trunk. But at the same, between L1 and L2 is where between L1 and L2 is where the renal arteries are coming off from the abdominal aorta. The renal arteries are originating from abdominal aorta at approximately the level of L1, L2, the junction between L1 and L2, and then the inferior mesenteric artery is coming, at the junction at from the L3. You see, this is L3, and the at the level of L4 is where the abdominal aorta bifurcates. It bifurcates to form 2 terminal branches, which are the right and left common iliac arteries. It bifurcates, forming 2 terminal branches at what level? L4. The abdominal aorta bifurcates at L4 to form 2 terminal branches. This looks like exam question, right? Like what does it bifurcate? Bifurcate at the level of L4. Next, let's see the structure which are crossing the abdominal aorta. Now, between the origin of the celiac trunk and the superior mesenteric artery, we have 2 important structures which are crossing the abdominal aorta. And number 1 is this one, which is called the splenic vein. The splenic vein is coming from the spleen to empty to this portal system, and so it crosses the abdominal aorta, this region between the superior mesenteric, between the celiac trunk and the superior mesenteric artery, but also the body of the pancreas. Only the body of the pancreas crosses the abdominal aorta. And this is also very, very important, because if someone has got tumors of the pancreas, they can, engulf the abdominal aorta, making it difficult to operate this tumor because it, invades the abdominal aorta, makes it inoperable. This is very, very important relationship, the body of the pancreas and the abdominal aorta, between the celiac trunk and superior mesenteric artery. Also have the splenic vein. Now, between the superior mesenteric and the inferior mesenteric, also have some structures which are crossing here. Number 1, you have the left renal vein. Left renal vein is coming from the left kidney to empty to the inferior vena cava. We've said the inferior vena cava is on the right side, correct? Now, this vein, because it has to empty the inferior vena cava, it has to cross the abdominal aorta, and it crosses the abdominal aorta between the superior mesenteric and the inferior mesenteric. Next, we also have an uncinate process of the pancreas. Now, the pancreas has got this shape. We have the body. The body of the pancreas is passing between the celiac trunk and superior mesenteric. We have seen the body is passing here, but the uncinate process is passing below the superior mesenteric, which means it is passing between the superior mesenteric artery and the inferior mesenteric artery. So what are the structures which are passing through the which are crossing the abdominal aorta between the superior mesenteric and the inferior mesenteric? Number 1, we have seen we have the left renal vein. Number 2, we have the uncinate process of the pancreas. Number 3 is this third part of the duodenum. Very, very important. This is because the third part of the duodenum passes below the superior mesenteric artery, and we are going to discuss later that the superior mesenteric artery can compress the third part of the duodenum here, resulting into condition called the superior mesenteric syndrome. Very, very important. We're going to discuss about it at some point. Superior mesenteric syndrome. The third part of the duodenum is compressed between the superior mesenteric and abdominal aorta. It's compressed. this can result into intestinal obstruction of the intestinal lumen, and it's very, very important. Lastly, let's discuss about the relationship between the common iliac artery and the common iliac vein. Now, we've said the common iliac artery, these are the two terminal branches of the abdominal aorta. Abdominal aorta bifurcates at the level of L4 to form two terminal branches, which are the right common iliac artery and the left common iliac artery. Now, the right common iliac artery crosses the left common iliac vein. This is the left common iliac vein, this is the right common iliac artery. The right common iliac artery crosses the left common iliac vein, and this relationship is very, very important because at times the right common iliac artery can compress the left common iliac vein, resulting in two venous stasis. The blood stagnates downside, and because this left common iliac artery drains blood from the left lower limb, it results into stasis of blood in the left lower limb. So this results into congestion of blood in the left lower limb, and they can result in formation of deep venous thrombosis. And this is one among the common reasons for why the pregnant ladies will have the deep venous thrombosis on the left side, on the left leg. Deep venous thrombosis in pregnancy is common in the left side. Why? This is the question. Why? Because the right common iliac artery can compress the left common iliac vein here, resulting into stasis of blood in the left side, and so we have what? We have venous congestion on the left side. It can result in formation of deep venous thrombosis. And because of pregnancy, we have the uterus, the baby in the uterus compresses also these arteries. Then the arteries compressing the vein resulting into stasis. This is very, very important relationship. You can never forget about it. And it results in this condition which is called the May-Thurner syndrome. So the May-Thurner syndrome is actually the compression of the left common iliac artery by the right common iliac vein by the right common iliac artery here, resulting into all this that I've explained. We're going to discuss it again when I'm doing the anatomy of the pelvis. And last, let's see the blood supply of the abdominal aorta. Now, the abdominal aorta also receives blood through the small vessels which are called the vasa vasorum, and the vasa vasorum translate into vessels of the vessels. Like these are small vessels that are going to supply the big vessels like the abdominal aorta. This is to say the abdominal aorta receives blood by the way of the vasa vasorum. Now, the vasa vasorum, they are absent below the renal arteries. Below the renal arteries, the abdominal aorta has got no vasa vasorum. So how does the exchange of blood takes place? It's going to take place by the diffusion, and this is made possible because the abdominal aorta is thin-walled below the renal arteries. Below the renal arteries, the abdominal aorta is thin-walled, and because it's thin-walled, to allow the exchange of blood easily by diffusion, it predisposes itself for aneurysm. It predisposes itself to aneurysm, abdominal aneurysm of abdominal aorta. They are commonly below the renal arteries. Why? Because below here we have the thin walls, and the thin walls are made purposely for exchange of blood by diffusion, but they are predisposing the abdominal aorta to the aortic aneurysm. Okay, this sounds like pretty much it, and I will take questions if any. But if you have question, additional comments, you can put your thoughts in the comment section, and see you into the next discussion. Bye bye.